Oh, no.
Yeah.
Hi, this is Miguel Gomez with HIV.gov. This is our second live feed from PACHA's 80th meeting in Houston, Texas. Earlier today, there was an incredibly thoughtful and powerful presentation on Black and Latina women, cisgender women, and PrEP. And I have two amazing colleagues here. I'm going to ask you, for our viewers, will you just introduce yourself? Let them know who you are.
Sure. Natalie Sanchez. I'm a director for UCLA Los Angeles Family AIDS Network.
Hi, everybody. My name is Raniyah Copeland. I am the CEO of Equity and Impact Solutions.
Two amazing skilled champions in the HIV response. So we're talking about women in HIV. Could you give our viewers just the facts, just some general facts? What does it mean when we're talking about PrEP and women? Let's start with our Latinas.
Yeah, well, I think it's great to just look at new diagnosis in cisgender women. So that means women who were born female at birth. And so when we look at the data, there was 6,200 new HIV infections in cisgender women. And what the data shows us is that that number has been stable. So we haven't seen any decreases in new infections, which means that there hasn't been any progress related to HIV prevention or related to PrEP uptake in women.
I think PrEP is one of the areas that we haven't seen great progress really across the country when it comes to communities that have historically been marginalized. When we look at Black people and PrEP, in 2022, Black people made up only 14% of all PrEP users, though Black people are around 42% of new diagnoses. And then when you look at who's using PrEP, 92% of PrEP users are men, though women make up 18% of new HIV cases. And so PrEP is something that we know can really be a part of how we end the HIV epidemic. It's part of why we say we can end the HIV epidemic, because we have PrEP, but it's not getting to cisgender women.
And I was sitting in the back of the room because I was having to do some things to prep for some of the live videos. And I have to tell you, people were not on their phones. They were paying attention to your presentation. Could you share with our viewers, what was the goal of your presentation? Because it was multifaceted. I was really impressed.
Yeah, we wanted to really highlight some of the challenges and opportunities when it comes to Black and Latina cis women in PrEP. It's not a conversation that we have enough. We don't have a lot of spaces where we're talking about Black and Latina cisgender women specifically in PrEP. And so we really wanted to highlight what are some of the opportunities, what are some of the challenges, what are capacity building needs, what are some of the clinical needs, what are some of the research needs, what are the cultural sensitivities and considerations that need to happen, and really trying to put forward some potential recommendations that the federal government can take when it comes to trying to increase uptake and utilization of PrEP amongst these communities.
Yeah, I mean, it was also a reminder that PrEP has been around for 12 years, and so we're seeing changes in the epidemic because there is uptake in different communities. The challenge is we're now having a panel 12 years later that wants to integrate women, and we're looking for the solutions. And what we heard from the panelists is that we're not going to see those changes happen. It's not going to happen overnight. And so while we need strategies at the structural level, and we also need individual approaches that are culturally competent, culturally sensitive to the Latinx and Black communities, is that we also need to I lost my train of thought. This is what happens when I'm on the spot. We have to be patient. You know, that we're going to invest, but it's going to take a while before we get some traction, because we're again starting to address women in PrEP just now, whereas with the other communities, they already have 12 years of progress.
And I love what you just shared, because you really focused on what the multiple presenters during your session presented. There are incredible amount of challenges when we're talking about this community. There was also rays of hope, but for both of you, is there one or two key takeaways that you would like to share with our viewers? Please, Natalie.
Yeah, so I think the key takeaway is what we said was prioritizing women, cis women. So when they're not part of the prioritization process, we forget about them. And that means that no funding gets directed, no strategy gets funded for cisgender women. And so again, I think the call was, we need funding for cis women related to HIV prevention. We also need a goal related to, stable is not progress. How do we measure a decline and being able to invest funding into the reduction of new infections in cisgender women.
Absolutely.
For me, one of my biggest takeaways was really the limited resources that we
Yeah.
have that are focused on Black and Latina cis women and PrEP. When we asked about what are the capacity building resources, who's doing the funding, there weren't a whole lot of responses. And I think that we can kind of think that maybe in our own silo, oh, maybe I just don't personally know, but to be in a place like Texas, to hear that the last types of like capacity building programs they had were over 5 years ago or never. When we talk about Latina women, we didn't even talk a whole lot about, what are the monolingual needs of Latina women. And so it just felt like there were really some needs for dedicated resources. We heard some things about SPIN's project for Black women that's ending this year. And so it was like a one-off here and there, but there really hasn't been long-term dedicated resources to this community. And I think what everybody agreed on in our panel and the room agreed on was that when you focus on and center women, you engage the entire community. And so you, in some ways, get a twofer. You make sure that you are impacting these communities, but also bringing the whole community and population along. And so really this need for dedicated, long-term, multifaceted resources to support this work.
Well, I want to thank you both because you really generated a call to action today. And I want to encourage all our viewers to visit hiv.gov because we'll also have a blog talking about today's conversation, but we'll also share some places you can go for more information on PrEP, especially when we're talking about PrEP for the communities we just discussed. But before leaving and ending, is there any places that you would like to send our viewers for more information?
CDC has an amazing initiative called She's Well that focuses on Black women and PrEP. It's been piloted in a few jurisdictions, but I know they're looking to expand. I think Black Women's Health Imperative has an amazing program that talks about Black women and HIV and really being HIV possible. We had a panelist here today who was a part of that initiative. And so really thinking about how we can utilize some of the resources that are homegrown, resources that are been piloted in certain jurisdictions that we can expand even greater. So if you can, make sure you visit those places.
Natalie?
Yeah, I just want to plug in Los Angeles Family AIDS Network. We have a podcast. It's called Confessions Podcast.
It's really good.
Our first 2 seasons are focused on, first season on Latina women living with HIV, second season, Black women living with HIV. And we want to dedicate our 3rd season for cisgender women who are on PrEP, sharing their experiences, accessing and sustaining and maintaining being on PrEP.
I want to really thank our PACHA members. We're going to run back into the meeting because it's the public comment period. This is Miguel Gomez with hiv.gov.